Hey, it's Brad Perry with Kingwood Physical Therapy. I'm going to talk about knee pain today, especially in the anterior part. So the anterior knee means the front of the knee. So we get a lot of people that come in and they're complaining of anterior knee pain. So pain right here in the front. And there's many different reasons for that. And some of the exercises that we'll go into today, and then we'll talk about some more exercises to do later, but can address this anterior knee pain. So we're really going to get into the anterior knee pain today and exactly what's going on. So sometimes the kneecap itself, the patella, can grind a little bit back and forth. It fits into this little groove sometimes. And that little groove can kind of get a little bit irritated and cause pain to come out in the front of the knee. There's also the patellar tendon. This is basically attaches the patella or the kneecap to the tibia, which is part of the shin bone, right? And that little spot there, okay, can also cause what we call anterior knee pain, right? And that can get irritated and cause like tendonitis type of issues. Sometimes we will see this in adolescence. So someone that's kind of going through puberty, this patellar tendon attaches to this bone and can kind of get irritated after activities like playing sports and things. And then there can be knee pain like right at the top of the kneecap. And that comes from the quadricep muscle itself coming down, and it creates a tendon that attaches to the patella, which is the kneecap, right? And it can cause pain right here because it can get inflamed as well. So that can occur with anyone. If you're bending a lot or squatting a lot or kneeling a lot, sometimes you can just get generalized knee pain, and usually on the anterior. We'll probably see more anterior pain than anything else. Sometimes we'll see, this is called the medial side, medial knee pain, and then lateral knee pain, and then posterior is the back. So we got inside, outside, back, or front. The front we call anterior, right? And so the different reasons for that knee pain, and we can take care of them all by prescribing you the right exercises and really working on some other soft tissue components that might be going on. If the quad is tight or the hamstring is tight, we will kind of work on that from a manual aspect. So, okay. Now we're going to kind of dive into some exercises to help with that pain. Exercise we can get into is called a hamstring lengthening exercise. So we call it supine because they're laying on their back. Hamstring, which is in the back of the knee, we're trying to lengthen it a little bit. And then also, we're really going to try to strengthen up this quad. And this, again, helps mostly with anterior knee pain. It can help with other knee pains as well. It can help with posterior knee pain as well. But so you'll see us prescribe this for different reasons. So this is called a supine active hamstring stretch, okay? So what he's going to do is grab behind the knee, okay? And we want the hip, this angle right here, to be 90 degrees, okay? And then this knee needs to be relaxed, right? And so he's holding back here. And as he holds that there, now the next thing he's going to do is try to keep this straight and straighten out his leg, okay? So go ahead and straighten your leg. So right here, the quadricep muscle is tightening up, right? And it's causing the knee to go into what we call extension, okay? And then in the back side, it's actually lengthening the hamstring a little bit too. So if it's a little tight, it'll start to kind of stretch. So usually we tell people to hold it about 10 seconds, 5 to 10 seconds, and then back down, right? All right, and then back up again. So usually we're holding it at 5 to 10 seconds, and we'll tell someone to maybe do it about 10 times, and then we'll prescribe 2 or 3 times a day. Okay, so it's a good one to try if you're having any kind of knee pain in the front or the back. All right, this next exercise is a quad lengthening exercise. We're getting that quad to really kind of stretch out a little bit. And so this here, we've got him in a prone position, so he's on his stomach. We put this leg on the table, okay? On the floor. So we put this leg on the floor. This leg is on the table. And we're going to bend this knee just like that. And as he bends the knee, he's contracting the hamstring. So it's a little bit of a hamstring kind of strengthening. But we're really lengthening that quadricep muscle that can get really tight. So someone having anterior knee pain, pain in the front of the knee, this can help sometimes with that. So it's kind of lengthening that quad tendon, quad muscle a little bit, and activating the hamstring. okay? Now, if this hurts, there's some other variations to it that I'm going to get into as well. So you do this about 10 times. Hold it 5 seconds or so. Good to do a couple times a day. This exercise is good for, of course, knee pain and trying to get that terminal knee extension, trying to straighten it out. So what you need is a band and a good solid post. And you wrap the band around like a post, okay? And then you're going to come in and you step in and you pull this band up to, and I tell people to put it right above the knee crease in the back. So just above that crease in the back like this. Okay, put the leg back just a little bit. There you go. And so you bend the knee, and then now you're going to straighten the knee out and really tighten up that quadricep muscle. As they tighten that up there, I'll tell them to hold that a good 5 seconds or so, and then release the knee a little bit. Okay, so you can do this pretty easily. He's not putting a ton of pressure through his knee, but we're actually activating that quadricep muscle. So you just need that band. We got a little cushion behind that. You don't really need that as well, but just want to tighten up that quad, hold it, do about 10 to 20 of those a couple of times a day, and that's going to really get that quadricep muscle firing, okay, which can help with knee pain and also help with, if you're lacking extension, to get that knee a little bit straighter, okay? And to make it a little harder, he can always step that foot back a little bit and get into a lunge position, okay? And then he can straighten out into, so stand up right there, and now straighten it out. Okay, so now he's putting a little bit more weight through this knee and doing it. That's the way to make it a little bit harder. We're going to talk a little bit about the squat today, and a lot of people have different types of knee pain, and we really dive into how to do a squat correctly, because if you do it incorrectly, it really loads that front part of the knee and can cause a lot of pain, okay? So sometimes they'll come in and they'll do a really quad dominant front loaded squat. So as you can see, like he's going into what we call a pretty quad dominant, puts a lot of pressure on that. So someone kind of goes in like this. Sometimes we'll even see this where they dive in a little bit. We want to correct that and get the hips moving first and then bending the knee to do a proper squat. So sometimes squats hurt. So what we do is we do like a little mini squat. We call these butt taps. We're just going to tap the butt up against the wall here. So what you're going to do is just get about a foot away from the wall. So you can get a foot away a little bit more. Yeah, there you go. Oh, too far. Back up. Right there. Good. And what he's going to do is try to move through the hips first and then tap his butt onto the wall as he goes down. You can kind of see him reaching out there. Good. And back up. So you can see he's now using his hips first and then bending his knees, where earlier what we saw was the knees bent first and then the hips, right? So we really want to work on what we call a hip hinge and really getting the hips to move backwards first, getting the glutes to fire, and then the quads. And that's going to take a lot of pressure off the knee if you're coming in for knee pain, okay? So usually, you can go ahead and do it again. There you go. I'll tell them to do this 10 times, maybe 2 sets of 10, 3 sets of 10, depending on how irritable they are. But again, we're not doing a full squat. We're not even going far enough down to have a seat in a chair, right? So we always got to, go down into a chair, and this is a way to properly do it, basically, okay? So doing 2 or 3 sets of 10, doing these once or twice a day, depending on how irritable. Make sure it doesn't cause pain, and if it does, we actually have a backup plan for you on that too. So, all right, so this is the butt tap.